From 10 feet onto a metal fence. Hang on to it for now.
Does your belly hurt?
I can't evaluate like this.
And the knee down.
Two of you, tip fit, pushing down the tourniquet, Whitaker.
To give the residual limb blood.
There are those. Park.
Park the shark.
On ice.
Sterile saline on the inner bag, ice water in the outer bag, no direct.
I'll book an OR. Irrigate the hell out of this with 3 liters.
3 liters?
With saline, genius.
Thanks, Shark.
I knew he meant saline.
Dr. Robbie?
Most common reasons for traumatic replantation failure is infection, so we do what, Whitaker?
Rinse and repeat until surgery calls for us. Is everything okay with Dr. Mohan?
She's fine. Focus.
Sure. Hypoxic, bradycardic.
Kidneys and airway before you're ready.
I can't tell if there's lung sliding. No movement, no air entry.
Boss, show me what you got.
A lot of blood.
Now it's a tactile procedure.
Insert the ET tube into the trachea.
Check the CO2.
Sounds are coming up in the 80s.
Bilateral breath sounds. And tidal CO2 is 70. That's crazy high.
It'll come down. Tie down the tube, control all the bleeders. Spray an Empavepi on a stack of 4x4s.
Okay, sats are up to the 90s. Good, CO2's in the 50s. Good heart rate.
You forgot the last step. Change your underwear.
How many of these you done?
First one.
You serious? What about you?
None. About fucking time.
If I knew you were gonna make me wear a dress, I wouldn't have come at all.
Dennis Whitaker, meet my buddy Duke.
Nice to meet you. Any friend of Dr. Robbie's? A friend of mine?
Friend is a vast overstatement. He's more just a pain in my ass.
Don't let his surly exterior fool you. Deep down inside, he's just as grumpy.
How did you two meet?
Tinder.
Duke is a motorcycle engineer.
You should have seen his Bonneville when he first brought it in 6 months ago. Someone left it for dead.
He helped me bring it back to life. Today, we're going to return the favor. Dr. Whitaker is one of our most trusted physicians, and today he's going to help me oversee your care.
What seems to be troubling you?
Ask him. He's the one who made me come in.
He's had some hoarseness on and off for a couple months.
Okay, any history of tobacco or alcohol use?
2 of my oldest and closest friends.
Former 2-pack-a-day smoker and lover of the drink.
Okay, he on any medication?
Blood pressure meds.
Which he forgets to take.
He's all numbed up and ready to go.
Okay, thank you, Donnie. My man, I'm gonna take this scope and I'm gonna stick it in your nose and we're gonna check out your upper airway.
Seems like a lot of fuss for a sore throat.
Dr. Whitaker, you wanna explain to Duke why this procedure is absolutely necessary?
The scope is going to give us a better view of your voice box and your vocal cords.
Here we go.
Yeah.
I feel a little pressure between your eyes. I am sorry about that. Okay, just breathe through your nose.
This is going to help us see if there are any abnormalities like inflammation, tumors, nodules.
That all looks pretty normal. I don't see too much drainage. Stick your tongue out for me all the way. All the way out. Good. Now say E.
E.
Good. Now again say E.
E.
Good. Removing the scope. Dr. Whitaker, what do you think?
Looks normal, no abnormalities.
Told you it was nothing.
Yeah, with your history of smoking, I'd like to do a chest x-ray. If there are growths, they can push against the recurrent laryngeal nerve intermittently. That can paralyze one of the vocal cords and cause the hoarseness.
That sounds like a lot of bullshit doctors speak to charge me more.
You've got Medicare. Besides, I finally got you into my ED. You're going to get the golden workup before I leave town tonight.
Only an idiot would ride all night after working a 12-hour day.
That does sound pretty
You
dangerous.
gonna stay put or do I have to tie you down?
Fine, so long as you keep your hands where I can see them.
No promises. Let me know when his chest x-ray's back.
Yeah. Yeah. Thank you. Yeah, bye. Oh, hey, I just got a hold of the sister of the heavy patient. Abbott's taken a Presby. She still lives in Arizona, but she is willing to talk to him when he's back.
That's good news.
When do you think that might be?
Depends on how crazy it is over at Presby. If it's anything like here, who knows?
Yeah.
His help on the way.
Ah, you little faith.
Hypotensive, acute abdomen. She needs an airway.
I'll find the blind scope.
No time for that. We've got direct on the crash cart. Whitaker, you're up.
I haven't done many directs.
And you need to do more. Induction nets.
100 ketamine, 80 of rock.
Jabati, what's the story? bolus in the 500 cc's?
You shocking her?
From a condition, probably put her there. Let's go ahead, Whitaker. Take a look.
Yeah, bagger. That was harder without video.
We won't always have video.
Hey, buddy.
Take mode.
Did you order?
CBC in our chem panels.
Something should be back.
Fax machine ran out of toner. Check the chart. This rack.
Burns?
Claire Burns, order slip. Never drawn, never sent off to the lab.
That's because the patient wasn't on the board. Nurses are working zones. If the patient's not on the board, they don't exist.
So they didn't shoot her x-ray?
X-ray downtime box is empty. That means it was...
Really great work earlier today, doctor.
Huh. Oh, you can just call me Whitaker.
Not a chance. You earned that. I'm proud of you. We all are.
Thank you.
Busy day.
Oh, yeah.
So, you're a very empathetic soul.
Yeah, I'd like to
I'm
think
not finished yet. And you want to be there for all your patients.
Don't you? Shh. Sorry?
So this relationship that you're having with this woman, the widow of the burn victim who died last year.
Amy? Santos tell you?
I understand you're helping her out.
Yeah, on the farm. Look, I grew up on one, and Amy's, Mrs. Miller, is getting pressure to sell, so I'm just helping out.
What about her friends and family?
Yeah, they're around.
Supporting her?
Yeah, I think they try to, but mostly she's just leaning on me.
Sure, she's really grateful for everything that you do. But it's important to have boundaries.
Yeah.
Hey, you want to do me a favor?
Yeah?
You want to house sit for me while I'm gone? You'd actually be helping me out, and you could save some money on rent.
Are you being serious?
No smoking, no parties, no pets, no babies, yours or anybody else's.
We don't know. I don't have a baby.
No, but she does. I was going to ask Abba, but he does nude yoga at sunrise, and I don't think some of my elderly neighbors would survive seeing that.
Yeah. Yeah, that would be amazing. The house sitting, not seeing habits naked yoga.
If I don't come back, you got a swinging bachelor pad.
Okay.
Come find me before you leave. I'll give you my keys and a security code.
Who's the joker that did this?
Hey, Ogilvy spiked the bottle for me?
What tests do we want on these fluids?
Cell count to rule out spontaneous bacterial peritonitis.
Ding! What would make that diagnosis, Joy?
Absolute neutrophil count over 250.
How are we doing in here?
They are doing great. I think they got this.
Get ready to spike the third bottle here after I clamp.
All good in here?
Yes. Dr. Whitaker was just explaining that with SPP, we would see a turbid appearance. However, he failed to mention that bloody fluid indicates either a traumatic tap or the likelihood of hepatocellular carcinoma, in which case we would send for cytology.
That is correct.
Kid knows his shit.
He's so smart.
Nursing home that can take her today?
I wish. Medicare requires a 3-day hospitalization before they'll approve that.
I don't really have a reason to admit her.
But I do. She's gravely disabled. I'll put her on a psych hold. We'll make it work.
Thank you, Caleb.
Yeah, you have a few moments, Michael?
I can give it a try.
Dr. Garcia is a very skilled surgeon. If she can't get it, we need to think of something else.
Like what?
Hyler flip. You're gonna rotate the lung 180 degrees.
Heart feels empty.
Okay, we fixed the leak. Now let's fill the tank.
Am I missing something?
Social skills?
He looks so peaceful.
Should we maybe go find a new patient?
No, stay here.
Asystole.
Quick and painless. We should all be so lucky. I'll try to contact some family.
Yeah, one of the things we like to do here, when we have the time, is to take a moment of silence when we lose a patient, to respect their humanity. He was someone's son, perhaps a father himself, a brother, a friend. Oh, just make sure your phones are on silent.
It's French, twisting of the points.
From prolonged QT, antiarrhythmics, electrolyte disorders.
Your patient would have lived if you had pushed magnesium sulfate.
Good news is he's an organ donor. Parts of him are plastics in our brains and reproductive organs.
Thank you for the words of encouragement, boss.
Dr. Alashimi, Dr. Michael Rabinovich, everybody calls me Rob. He has a hard time expressing your feelings.
Not all of them.
Did you know our farm boy here is a vintage funk freak? Unfortunately, he also likes to use other people's toothbrushes.
There was one time. They were the same color.
What's your plan, Samira?
Chest tube to the...
Langdon's waitress with the cellulitis?
Yeah.
Man, that took a turn.
Sure did. Hey, did you hear about Louis?
Yeah.
You okay?
One of my uncles drank himself to death. Barely recognized him at the end. At least Louis always seemed happy.
I'm here if you want to talk. You thinking it's surgical?
Hoping for a non-perf dappy.
Can you do it with a scope?
Possibly, but he could be treated with antibiotics alone.
If he needs surgery?
With his size, an emergency open laparotomy death rate's close to 50%.
Okay, one step at a time.
Okay, resume compressions. Code STEMI, it was posterior.
Yeah, good call.
Normal size.
Strong pulse, check a BP. Really good pickup, Whitaker.
Thank you.
Is it patient?
Dr. Collins finished her residency. Took up a job in Portland as an attending physician.
Portland?
Yeah, I think that's where she's from. She's adopting a baby. Wanted to be closer to her family.
Wow, that's a beautiful thing.
We're set.
Okay, ready?
I think I'm a baby whisperer.
Hey, great. We'll add Baby Jane Doe to your patient load.
Forget I said anything.
Where are we with your deaf patient, Harlow?
The VRI was a bust, but the interpreter's on the way. Figured I'd just give her a head and belly scan and go from there.
No, wait for the interpreter. No need to give the patient unnecessary radiation. And your charting?
Catching up and checking it twice.
Good. Hey, have you had a chance to speak to Langdon today?
No. Why, did he say something?
No, just curious. How is everything at home with you and Whitaker?
He's weirder than you'd expect. Yeah, but I don't see him all that much. He spends a lot of time at Amy's.
He has a girlfriend?
I don't know what to call it. The farmer who got burned last year, the day of the mass cache, his widow, Amy.
Oh, he died?
Yeah, he had burns on 90% of his body. His chance of survival was very slim.
Okay, so I'm an optimist.
The sun doesn't always come out tomorrow, Annie.
Wait, wasn't she pregnant?
No, she was a young orphan.
No, not Annie, Amy.
Yes, very pregnant and young.
And Whitaker's now seeing this Amy?
And her baby. He got really close to the family when the husband was dying. He really believed that the guy would pull through. He helped her through the loss of her husband, and then again when she had the kid, and now he spends almost every weekend at the farm.
Huh.
Plus, he's on the street team, and he just wants to help everybody, and I just don't want to see him taken advantage of. You know, he's just a fucking huckleberry.
Yeah. But he's our fucking Huckleberry. I'll talk to him.
Hey, your call.
Strong deflection, well played.
You're the boss. Or you are until end of shift today.
Still the boss. When you see me in here, still the boss.
Copy that, boss.
Patient registration, electronic health records, lab, and ready.
Man,
Such a prick.
you got a second?
What's up?
12 lead on my chest pain patient shows no STEMI, but the anterior leads might be suspicious for a posterior MI.
Agreed.
Yeah, I was gonna repeat, but with the chest leads on the back.
V7 through V9, good idea.
Thank you. Hey,
It is.
what's going on at Westbridge?
They're closed, so we're covering their paramedic runs until they come back up.
As if a holiday weekend wasn't enough. So, Dr. Al-Hashimi,
Yes?
do we like her?
She seems pretty cool so far.
You're trying to gossip about an attending with an attending? Dr. Robbie doesn't mind, do you?
It's a nice bike, by the way.
Thank you.
Yeah.
Pain with vomiting after eating chilaquiles with fried eggs. BP 108/64, pulse 98, good sats.
Okay, let's see how she feels with some Zofran and a liter wide open.
Got it.
Yo, Whitaker.
How are you feeling, Miss Carey? Not so good.
Who do we have here?
Jean Samba, 54, half vitals, no STEMI on 12 lead, gave him 324 chewable aspirin.
Okay, we're gonna give you a full evaluation, sir.
I am to die. God willing, I will see his pearly gate.
What's the plan?
Repeat 12 lead, check a troponin, admit for new onset angina.
Evaluate for P, aortic dissection.
That goes without saying.
Sounds good. I'm a minute behind you.
Top shelf, Louis, I promise.
How we doing in here?
Good. Almost 4 liters out.
I already feel like $1 million. I just needed an oil change.
And I'm just about to drain an apical abscess.
That's what I'm talking about. I feel like I'm having a spa day.
Keep it up, Whitaker.